Welcome to today's program titled Passport to Normalcy, the Opportunities and Risks for Businesses and COVID Passports. At this time, all participants are in a listen-only mode. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the conference by typing them into the Q&A box on the right-hand side of your screen. We have a very full program today, and we will respond to as many questions as possible. For those interested in obtaining CLE credit for this webinar, an attendance verification code will be read during the presentation that will be required on the CLE attendance affirmation form. Please write this code down as it will not be reread and is required for CLE credit. Copies of the webinar, recording, and materials along with the CLE attendance form will be distributed to attendees in the days following the webinar. On the next slide, you will see a legal disclaimer. This program will be primarily a roundtable discussion. Please feel free to change your WebEx view from the speaker view to the grid view should you prefer. You can find this by clicking the layout button in the upper right-hand side of your screen. At this time, I would like to turn it over to our MC for today's program, Ann Dana. Ann, please go ahead.
Hi, everyone. Thank you so much for joining us today. We think this is going to be a very interesting discussion about a hot topic right now, COVID passports. So today is going to be a roundtable discussion, and we plan to cover topics such as what are COVID passports and who is issuing them, why has this become such a hotly debated issue, data privacy and technology, as well as personal autonomy, equality, access, and accommodation, and what employers can start thinking about right now. You should have received a series of alerts our firm published leading up to today's event as part of your materials, but please let us know if you didn't get those. And now I'd like to introduce our guest speakers for today. First, I'd like to welcome Andrea Serra, who is a project lead with the World Economic Forum's mobility team. Andrea, can you briefly tell us about your role with COVID passports at WEF?
Yes, absolutely. Yes, absolutely. Thank you so much for the opportunity to present. I'm sorry, I'm listening to everyone. Is this better? Okay. Yes, I can't hear myself now. Anyway, thank you so much for the opportunity to speak today. So I'm Andrea Serra. I'm with the World Economic Forum, and I sit within our aviation, travel, and tourism team, where I have been leading our work on leveraging technologies for safe and seamless travel, including digital identity, biometrics, blockchain, and mobile devices. Since the beginning of the pandemic, we have quickly shifted our focus to include health data and health credentials, now that these are an essential part of the discussion around reopening borders safely around the globe. The forum, as you all know, is the International Organization for Public-Private Collaboration, and many of our partners and members are very active in the COVID passes or COVID passport space. We, as a forum, our role is to serve as a neutral convener amongst this rapidly evolving ecosystem, and also a key collaborator with international and regional bodies that are currently focused on standardizing and creating protocols and guidance for safe border reopening. So looking forward to the discussion.
Thanks so much, Andrea. Now I'd like to introduce Mark Friedman, Vice President of Employment Policy with the Chamber of Commerce. Mark, can you also briefly tell us about your role with COVID passports?
Yes, of course.
Yes, of course. Thank you.
Thank you for having me. Good morning, everyone. Maybe good afternoon in some cases. Yeah, so the Chamber, our mission is to represent the interests of our members, in many cases in the role of employers, in various policy debates that will impact them. So with the COVID passport issue, we really don't have a singular message here. Our members are involved in this issue on various levels. Some, like the airlines and the hospitality industries, are anxious to use them to help give some of their customers some assurances that there won't be exposures in their place of business. Some of our members are involved in helping to put out electronic versions of these credentials. So we really are sort of in this debate in lots of different ways. If I could probably suggest a unifying theme, I think it is that our members don't want to be prohibited from using these, and we'll talk about what's happening on that front. And neither do they want to be mandated to have to use these. They really want to be able to make that decision in accordance with their specific needs and how they operate.
Thanks. That's helpful, and we're definitely going to talk about what your members are interested in throughout this panel. Now I'd like to turn to introducing Lauren Gazinski, who is a fellow labor and employment partner with me here in our New York office. We have spent much of the past year counseling on COVID-related issues. And I'd also like to introduce Julia Gorham, a partner in our Hong Kong office, who focuses on helping employers tackle legal issues in the Asia Pacific and Europe, Middle East, and Africa regions. So in order to make sure everyone who's attending this panel is on the same page, we want to start with the basics. Julia, can you basically tell us what is a COVID passport?
Sure, thanks, Anne. And it's a great topic. So I think, as Anne mentioned, we've been advising on this. I can't believe it's still going, but this is the new normal. So obviously, there's a huge debate around passports. I'm using that comments when we talk about passports, and we're going to come on and grab some of the terminology that is benefit that as we go through this development. Really what we're talking about is some form of document. That could be a physical document. Most likely it's going to be a combination of physical and electronic records that show an individual health status. And within health status, we're talking about potentially their vaccine status, any medical or disability status that means they're not able to be vaccinated. Potentially it means, we've already seen a lot of people having PCR tests recorded on electronic forums or platforms rather. The other thing that I think we will start to see is potentially age, certainly at the lower age group. So for children who can't be vaccinated at this time, where you need to have children moving, we've certainly seen Israel come out this week and add children and their ages into their green pass system. So that's something that we would expect a lot of countries and businesses to start looking at. The other thing that's really going to be important with the COVID passport system going forward is going to be immunity status. So, it's something that I'm sure Mark and Andrea can talk about for a long time is what we don't have a good sense yet is of vaccine efficacy and longevity. So we don't know what the booster status is going to be and how long these vaccines are going to be effective for. So that testing for people's immune systems and immune responses might become part of a COVID passport system to see if actually they can still travel or access events without having to have further vaccinations. So that's something that's definitely coming down the pipe. I think the other thing that we see, certainly from an age perspective, is that we anticipate our passport systems, both internally within countries and externally, will be tracking movement. That's not the case in every jurisdiction because there is much more concern in some of the more Western parts of the world. In this part of the world, we're very used to having to QR code scan into businesses and sort of our movement is tracked quite heavily. We are in a very sort of compliance-minded sort of jurisdiction in Asia where we tolerate a relatively high level of intervention in our social lives. That said, the vaccine take-up is still relatively low in Asia, even though it is quite widely available in the more developed economies here. And we feel that that passport issues are going to be much more relevant to internal opening rather than international travel because of some of the restrictions we'll come on and talk about a little bit later. Andrea will come on and elaborate on this, but effectively, the types of passports that are going to be rolled out in the next few months and the coming year are going to be driven by the type of activity that you're looking at, and therefore driven by the governing bodies that are dealing with that. For international travel, you're obviously looking about jurisdictions and country-specific governance, as well as border controls and any overarching governance that we can achieve, as well as then sort of the much more internal sort of within specific states or jurisdictions and access to business that's driven very much by sector or particular private sector.
Thanks. Now, if anyone's been paying attention and reading the news recently, I'm sure you've seen the term passport, which is what these are being referred to commonly in public and in the news. Andrea, can you tell us why we might want to move away from the term passport and how WEF is referring to them?
Mm-hmm. Sure. So in terms of how we refer to them, we, as you all know, work very closely with the WHO. So we try to use their guidance and their terminology when it comes to this space. I think since the beginning, the WHO has been very clear that the use of the term immunity passport is not something they support, precisely for the reasons that Julia has just outlined around the unknowns around immunity. So that's definitely a term we don't use. The term vaccine passport is also it carries a negative connotation because the word passport is very specific to the passport document that we all use for travel. It's an internationally standardized document that is entirely governed by an organization called ICAO. It's a UN body that regulates the aviation sector. And it's a document that is exclusively issued by governments. So what we're talking about here in the COVID, in terms of COVID, is extremely different. It's something that should be accessible to all. It's something that will be issued by a wide range of issuers and health stakeholders. So we use many words. There's other words like passes, certificates, credentials. The EU is calling theirs their green digital certificate. So certificate has become a very common word. Generally, to refer to the entire ecosystem, we try to use the word digital health pass, which is pretty general and broad. And I also think it's important to encompass both testing and vaccination, because we really are trying to steer away from vaccines becoming the only requirement for mobility. We think that this poses incredibly complex equity problems and concerns, given that not everybody is going to have access to a vaccine or is going to want to get one. So.
Thanks, that's super helpful. And we're definitely going to talk about that equity and accommodation issue a little bit later in the presentation. For anyone who's traveled to countries or certain countries, they're probably familiar with the World Health Organization's International Certificate of Vaccination, or what's commonly dubbed the yellow card. What sets these new health passes apart from the yellow card?
Mm-hmm. That's a great question, and one that comes up all the time. I carry my yellow card all the time. So as you all know, yellow fever, the reason why this card exists, is really the only disease for which countries can require proof of vaccination for international travelers. And this is dictated by the WHO's international health regulations from 2005. These regulations have not changed since then. As I said, the position of the WHO is still that COVID vaccines should not be mandatory requirement for entry or departure from a jurisdiction, given all of the critical unknowns around efficacy, about variants, about accessibility and equity. And so, what makes this conversation about COVID passes different from the yellow card is, I think, three main things. First and foremost, there is a much more higher incentive for fraud this time around, right? I mean, yellow fever has not brought the world to a standstill, and it's not a major risk for international movement, whereas COVID really is because of the nature of the virus. So because of this incentive for fraud, we can't just walk around with the little CDC card pretending that nobody's gonna fake it. There's obviously already a lot of concerns around forgery and fraud. You can easily get some of these cards online. You can easily fake a test certificate online or Photoshop it yourself. And so we think that these cards are going to have to be shared in a much more secure manner, very likely digital format or some sort of tamper-proof format in both paper and digital. Second, I think the type of data that these passes are going to contain is very different than the yellow card. The yellow fever vaccine is pretty straightforward. You get one shot, it protects you, pretty much your whole life. It's very effective. But in the case of COVID, there's lots of unknowns. You need sometimes more than one dose. You may need boosters. There's all sorts of different types of vaccines. Some are accepted by some countries, some are not. And so, the type of data is really broad, and there's still a lot of unknowns. And the third is the fact that the yellow card is only required for entry into some countries. It's not required for everyday uses like returning to work or going to a concert or, traveling domestically. So I think the use cases are going to differ widely.
And that's a perfect segue into the next question, which is, what are some current examples of COVID passports that are being developed?
Mm-hmm. There's the answer to that is quite long. As you all know, there's a multitude of passes. I think when we started talking about this topic a year ago, there were maybe one or two. And now there's absolutely hundreds of them across all verticals, across all sectors. And I think broadly, you can categorize them into three areas is how we see them. You have some that are just solutions or apps that are targeted at a very sort of narrow or niche use case. Then you have organizations that are really trying to create global standards for how these passes should work. And then third, you have other entities trying to create trust frameworks that, develop a set of rules or protocols by which you can all trust one another and allow people to move within that context. So starting, I guess, from the from the top down, at the global level, you have two organizations that are really leading on the standards front, and that's the WHO, as you all know, and ICAO, the International Civil Aviation Organization. Both of them have proposed two different methods that are currently still in discussions as to how they're going to work together. But essentially, they would provide a trustworthy way for us to standardize the data that's contained in some of these passes, standardize the way that the QR code is read by any verifier around the globe. So I would expect these sets of specifications from these two organizations to be probably the most important frame of reference globally. Then you have at the regional level, there's many initiatives as well. Probably the most important one is the EU one. The EU came out last week with some specifications for what they call the EU Green Digital Certificate. Conversations are still ongoing on that. I believe that the certificate is not only restricted to vaccines because they don't want to make that the only requirement. So testing is also allowed as part of this scheme. This is still in discussions between the European Parliament and EU member states, and we believe it should be coming out by June, the final document. Another important part about that is that member states can decide how best to implement that, and they may have other domestic apps or approaches, but essentially they all have to be interoperable within the EU context. That brings us then to the national or country level. As you all have heard, there's pretty much every country out there has their own app or their own national system. You have the UK with their NHS app. You have France and Denmark. Denmark has a Corona Pass. China has their own one. Singapore has their own health certs system. And countries like Israel, which have been leading on the vaccination front. They have the highest rate of vaccinated population in the world. And pretty much they represent the best example of a country that has gone back to some degree of normalcy because of their green badge system. So that's really interesting to compare across countries. Moving on to the next level, and I'll try to be brief. There's the private and commercial applications out there. And this is where you see all sorts of, variety across passes. You have, IBM's Excelsior Pass, which is being used in New York. You have AOK Pass in Singapore, Block Pass. Muna Pass being developed by Agility for the Kuwait government. So if you want to go to Kuwait, you have to have a Muna Pass to enter. So it's in addition to that, you have apps by labs like Abbott. So if you get an Abbott test at a certain lab, you can download their app and then use that for entry into certain places. And then the last category I would say is non-for-profit efforts. And here you have a couple as well as industry-led efforts. So you have the International Air Transport Association. They represent the world's airlines, and they have what they call their IATA travel pass. And then the only non-for-profit effort I know of that is closely associated with the forum is Common Pass. And you might have heard this in the news as well, as it's being trialed by airlines around the globe currently. So.
Great. And we are aware that the World Economic Forum and the Commons Project Foundation are cooperating on an initiative to develop a framework for COVID-19 health status verification. What can you tell us today about that initiative and WEF's kind of current take on COVID passes?
Sure. So the initiative that we launched is called Common Trust Network. And really the idea of it was to harmonize the issuance of a health credential and to answer the very basic question of how can you trust the health data that comes from another country, right? If you're from Indonesia and you arrive at JFK, how does the government know or the airline official know that you went to a trustworthy lab in Indonesia or that you got an actual vaccine in Indonesia where you don't really know the names of the health providers there? So essentially what we're trying to do is to create a public registry that serves as a global public good that anyone can see of these issuers, whether it's a vaccine provider, whether it's a lab, whether it's a medical provider, wherever it is that you go get your test or your vaccine would be registered. They adhere to established global standards for health data sharing and exchange. And that basically any verifier would be able to check that issuer exists and that it's not some made up website where you can download a QR code, because it doesn't be something that's digital, it doesn't mean that it's safe and tamper-proof, right? You can literally get any QR code online and still pass through and make it, be a test. So what we're trying to do is to make that tamper-proof and, be able to facilitate mobility that way. In terms of our take on this whole ecosystem, honestly, we don't think there's going to be one single solution or one single standard that's adopted by the entire world. I think it's going to be a mix of national and regional solutions and private solutions all having to work with one another. What we want to avoid is to have a world where there's 1,000 different apps that people have to download for all sorts of different things. So one app to go to work, one app to go to the movies, one app to go to India. And it's just going to become such a huge burden in terms of the user experience, in terms of wide adoption of these passes. So our goal is to promote adherence to global standards, interoperability especially, and to have it done in a privacy enhancing and data protecting manner. So.
Well, I'm sure everyone on this panel or listening in today is hopeful that you guys are successful with that. So I want to turn next to kind of the next segment, which is going to be why the fuss. Lauren, we've been talking about this a lot recently, and obviously our firm just came out with an alert on this issue, but why have COVID passports created such a hotly contested debate, particularly here in the United States?
Well, two issues loom large. First, a business encouraging or requiring something only of some or all of its own employees or the third parties with whom they interact tends to attract less attention than the same thing being encouraged or required across multiple organizations or across multiple jurisdictions, certainly globally. More importantly, in cultures like the US, and I'll use the US as an example, in which individual rights receive so much emphasis, pushback is centered on the perceived infringement on personal autonomy and privacy. Many Americans resent greatly being required to wear masks, and some have flat out refused to do so. That goes back to last March. Ditto for being restricted in where you can travel, who you can see, how close you can get to them, et cetera, et cetera. Now, some resistance emerged to swabs up the nose for testing, because that is a fairly physical, entry into personal autonomy. Now more resistance is evident when we're talking about getting jabbed with the vaccine that rather often causes noticeable side effects, could be seen as having been rushed into use under emergency approval, and at least for the prevalent Pfizer, BioNTech, and Moderna vaccines in the US, relies on an mRNA technology that had not been previously used in a vaccine. So there, you add to that this far from insignificant distrust of government and the pharmaceutical and medical professionals pushing vaccines, and you have the fuss.
So how is this playing out politically and therefore legally here in the US?
Well, like mask mandates, we're seeing a strong split developing among states, largely along political lines. If you look at electoral maps in the bright red and the bright blue, basically it's the bright red that are against it, the bright blue that are for it, with some exceptions. Some states have viewed passports as viable tools, and in fact, I'm in New York and I'm hiding my birthday, but here's my New York Excelsior pass. And we'll get to that in data privacy. There's not much on this, but my birthday's on it and my name, as well as my QR code. So you have states like New York, and Hawaii is in the process of developing up one, as well as other states like New Jersey and Pennsylvania have voiced support for them. However, in reaction to passport discussions, some states have taken the opposite approach. And Mark kind of referred to this earlier for businesses in not liking to be told they must, or that they can't use them. There are states like Florida, Texas, Utah, Missouri, Idaho, and others are talking about it, like Georgia, Iowa, Nebraska, and Tennessee. And the arguments cited are concerns that they would violate privacy rights. So they talk about privacy, but I really think the real issue is personal autonomy. And for example, a month or so ago, Florida's governor issued an executive order that just 2 days ago was echoed by Florida's legislature in a bill it passed that not only prohibits government entities from issuing COVID passports, but also prohibits private businesses in Florida from, quote, requiring patrons or customers to provide any documentation certifying COVID-19 vaccination to gain access to, entry upon, or service from the business. So that's a prime example of sort of the anti-passport tact in some states. And at the federal level, the Biden administration has indicated that it does not intend to implement a federal COVID passport. That's what's been publicly stated. They could change their mind down the road, nor will it create a vaccination database. But one or more federal agencies like the EEOC are expected to issue guidance regarding how businesses might use COVID passports soon.
Thanks, Lauren. And I think that's a perfect segue to ask Mark to elaborate a bit on what you said earlier about your members, wanting control over making these decisions. Can you elaborate on kind of the current position of the chamber and its members on what's happening at the state level?
Well, first of all, the U.S. Chamber actually operates on the federal level, and we have state partners who would be engaged in those questions, like in Florida and Utah, as Lauren mentioned. We do look to the federal government for some role here, and I think there's some things that they can actually do constructively here. One of which is, and this was mentioned earlier, there is a great need to make sure that any kind of credential is legitimate. And so either in the paper form or some electronic form, we think the federal government could be helpful in reducing or eliminating the use of counterfeit credentials. The other one, and this has come up as well, is the question of interoperability and how credentials will be recognized between different jurisdictions, and maybe even state jurisdictions, but certainly between different countries. Let me add another comment here about the EEOC and something that we're hoping they'll do, but they have not yet gotten around to, which is there's a big question out here about employers providing incentives for employees to get vaccinated. It's most employers don't want to go down a mandate path. Mandates are sort of complicated because you're telling your employees thou shalt get vaccinated. The problem with that is it implies a consequence. And, unless an employer is willing to say, you get vaccinated subject to certain religious or health reasons, exemptions, or you're not working here, that's a tough position for an employer to be in. They may be able to do that. I think legally the consensus is they can do that, but they also have to know that they're going to get a lot of blowback and probably end up in court at some point. So it's not a comfortable position to be in to mandate these things. However, the alternative is incentive, and lots of employers have been going forward with things like extra paid leave, or even some cash stipends, various other things that incentivize their employees to get vaccinated. And in fact, some studies have shown that employees are more receptive to an incentive approach than a mandate. The problem here is there is a sticky question around incentives in terms of employees who don't get the vaccine feeling that they have been left out of the opportunity to benefit from the incentive. And there's a history on this question involving wellness regulations that employers were implementing that the EEOC has the ability to weigh in on, and they have not yet given us guidance on this question, which we find very frustrating. We think it's a pretty easy question for the EEOC to address. It's certainly in the public interest for them to say something that would allow employers to do incentives without fearing some type of legal consequence around it. But yet we have not heard from the EEOC on this question. We have asked them for guidance. They have not issued it. So I think that's a sort of a capsule view of where we see the government being able to be helpful in this cause, and what we would hope that, the parts of this problem that we hope that they might take up and address.
And can I just jump in real quick on the incentive issue? In today's paper version of the New York Times, so it was probably published online yesterday, they published a nationwide in the US survey about two types of incentives. One is cash at $25, $50, or $100. And the other was basically being promised you would no longer need to wear your mask. And for the cash, basically between the 25 and 100, it went from the low teens to the high teens in an increase in the vaccination percentage, which is a pretty significant increase. And for masks, it was even higher if you actually give people a clear path to lose them.
Thanks, Lauren. That's a great insight. Julia, I know we just discussed some of the things that businesses can start thinking about, but what are some practical steps that businesses can do to promote goodwill and reduce the legal risks in relation to its employees and customers, other than, obviously this incentive issue?
Yeah, I mean, the incentive issue is global. It's not just in the US. We have a little bit more leeway outside of the US, I guess, to deal with those. I mean, I think that really practical steps right now is honestly, employees are just like all of us individuals. We're heavily burdened by the vast pressures of the last year and the concerns that brings to bear. So I think employers should avoid trying to make or doing anything that makes that worse and adding anxiety to employees by adding layers where there is already sort of a huge amount of uncertainty sort of coming from relative governments and state authorities and those things. So I think just being clear about what your role is as an employer, as a good corporate citizen to your employees, but also within your business sector is the most important thing. And for me, that is about knowledge. It's about making sure that you understand what the stakeholders that you deal with most regularly are talking about, where they are positioning themselves, but also taking the pulse of your organization. Understanding what your people think about this issue is really critical to deciding what sort of rollout you're going to adopt in the future. What I do tend to see is that when companies are coming to us for advice, things tend to escalate. So people start asking about mandating vaccines because they've heard other companies are asking it. And that, for me, starts to become a self-fulfilling prophecy. So I think taking that step back and saying, do we really need to do this? Is this the right thing for our business? Or can we take a pause and really analyze what is going to be critical?
Mark, I'm curious if you have anything else to add, as we're talking about this kind of patchwork and uneven and evolving regulatory landscape, and what your members are talking about in terms of how to navigate this.
Yeah, so one of the things that really gives employers fits is having to work in different legal environments with different consequences and different standards. I don't know exactly what the end point on this question is going to be. I think Andrea was giving us some very good information about where this is moving and who the actors are. But I can certainly say that my members, certainly those who are operating in the international arena, really need some type of stability and certainty as to what the standards are going to be. It just drives them crazy because much as I love my friends at Seyfarth, they don't need to hire them if they don't want to. And then that becomes an issue in terms of, defending themselves and having to move about in these different environments. So some type of, hopefully this will settle out. We'll get one, two, maybe a few different, credentials that everyone can accept and recognize, and that will become the standard that everybody recognizes.
Julia, one of the things that we're hearing from a lot of our clients we're getting calls about as, we're seeing travel starting back up to a certain extent. Some of that is national and some of it's international. What should businesses be considering in relation to COVID passports and the resumption of business travel?
Yeah, so I think you're going to see huge variances. So as I understand it, look, the possibility of travel within the US is not that far away, and likely within the EU as well, potentially. Certainly for us in Asia, international travel is a long way away at this point. And that's primarily because we have such extreme quarantine restrictions in place. So even if we take a passport as a functioning and sort of standardized approach, which will include our testing status and all the rest of it, if I can get on a plane, I have to quarantine for 21 days in a hotel room when I get back. You know, sort of the proposed Singapore, Hong Kong travel bubble we worked out the other day was going to cost over $1,500 in terms of testing alone, which because of the multiple testing stages. So actually really making that practical is a long way off, certainly from the international sphere. And certainly employers, I think, need to think very carefully about whether business travel is critical in this environment. If you can make it happen within the US or within the EU, fine. Certainly for the more challenging jurisdictions and the longer haul things, the items that we're asking employers to think about is the amount of time that your employees are going to be away from home. So there's a huge impact, not just a financial impact in terms of traveling in this environment, but it's actually a huge issue in terms of people's lives and their sort of family sort of time. So think about that. You need to be bearing in mind the cost of insurance, not just for someone getting sick and contracting COVID on business travel, but also the fact they might get stranded. We've seen multiple examples of rules and borders changing while people are in a different country and then, you know, not being able to return home. So your insurance needs to be expansive enough to cover that. You also need to think about, you know, as an employee returns to their home country, do they actually need to move to a different accommodation so they can quarantine or self-isolate before they go back to their family environment if they've got a vulnerable member of family, for example, who they can't stay with. So it actually becomes quite a wide set of issues, as well as the mental health issues of your staff who've had to do long periods of quarantine, you know, needing to be a bit flexible about how you deal with those people after those periods. There was a question that came in, which I'll actually maybe flick to Andrea quickly, sort of on this related topic of travel, which is there any sort of move towards finding a way to sort of accumulate all the different sort of country and jurisdictional rules around travel into one place so that it's easy for people to find? I don't know, Andrea, if you've seen anything like that on the cards.
So it's a question we get all the time. It's a really complicated one. The answer is yes and no. There's not a single place right now where you can find all of the entry rules of a country because these change all the time. Literally as you said, every day there's a different rule and it's incredibly difficult to keep track of it. The best system that exists globally is actually a system that is owned and managed by IATA, the International Air Transport Association. It's called Thematic, and it manages the visa system. So whenever you enter a country, the system automatically checks that your visa is meeting the requirements, and that's all done automatically behind the scenes by the airline, and there's no, extensive process needed. But for COVID, it's extremely difficult because COVID requirements have not been input into this system, and it requires a whole lot of manpower to keep updating them on a daily basis. So currently, the answer is it's ongoing. We don't have a great system yet, but there are applications out there, for example, like Common Pass, that want to do the work for you, right? So they take, let's say a country requires ABC requirements. The app takes those requirements, compares that evidence against the country's entry rules at that point in time and tells you, yes, you can enter, or no, you cannot. And it issues you basically a green light to enter. So you don't have to worry about, complying with the entry requirements.
Okay. Another, and just quickly,
I'm sorry, Julia.
Came in. Oh, sorry.
Yes, and I think you were maybe going to say the same thing. A questioner just read my mind and said, well, for vaccines, can the quarantine requirement be less? And I don't know if they're in the US, but they might be, because the CDC in the US did say that quarantine was not required for those who are vaccinated, which is different than all the other COVID statuses we're talking about. And I think they're doing that in large part based on the fact that, the two prevalent vaccines in the US have efficacy rates in the high 90s, actually 100% with children and teens recently. But globally, do you think there's going to be a move to give a different status for quarantining for vaccinated people?
Selfishly, I'm going to say I pray, because I'm fully vaccinated and I still can't get out of quarantine. So I'd like to see my family at some point. Certainly in Asia, the approach is much more conservative. So you're still going to be required to quarantine even though you're fully vaccinated. We are hoping, and there are signs that the governments are thinking about relaxing that. There will still be something, and it will be significant. I mean, you're still talking maybe 14 days of sort of isolated quarantine, which is still quite long. I think it will be much more relaxed, as you said, Lauren, into the US potentially, and into the EU. I think we'll be moving a lot more quickly in that space. Actually, there was one more question, which I think, while we're on questions, everyone can jump in on, which the question was about immunity and how that would be tracked on COVID passports, and whether there would be a difference between, for example, immunity off the back of having had the vaccine, so the efficacy of the vaccine to sort of protect you, versus immunity that comes from having had COVID. So certainly from my perspective in this part of the world, the authorities are looking at immunity that has come from a COVID infection as being a relevant piece of biometric data that will go into a health status. It's just a question of, and that's going to be a sort of a scientist based on the local jurisdiction in which you're at and the view they take, unless you've got more information, Andrea.
No, pretty much exactly what you just said.
Okay. As long as we're dealing with questions, there's one in here about the incentive issue, actually two about the incentives that I think are worth taking care of right now. One was, how do you deal with people who have a disability or religious exemptions? And those are in fact recognized. The EEOC makes clear that if someone has a religious objection or they have a certain medical issue that prevents them from getting a vaccine, that you have to accept those as legitimate exemptions. What you do with those folks in your workplace is another question, but the point is they can't be forced to get the vaccine. One other question about the incentive issue deals with how you would treat something like a cash bonus or cash incentive under the Fair Labor Standards Act, and would that have to be taken into account with respect to overtime rates and the like. And I'm going to sort of get a little bit out over my skis and hope that the lawyers on this call will slap me down if I go too far. But I think that would be regarded as the type of bonus that does not have to be included in the calculation of the regular rate. It's outside the normal scope of your activities. And so I think it would not have to be taken into account when you're calculating regular rate for overtime.
Just real quickly on that, as somebody who does wage and hour, I want to believe Mark's right. I think he's right, but we don't have any guidance on it. And I'm quite sure that we're going to get some plaintiff's wage and hour attorney who's going to claim that the incentive is directly related to getting them more effective for work, and so therefore should be put at a regular rate. So we can't guarantee it, but I want to believe Mark's right.
I think Lauren's exactly right. Yeah, we're flying a little bit blind here. The good answer would be that it's not included. We can't give you any certainty that that's going to be the final answer.
All right, that was a vigorous back and forth with questions. Turning kind of to the next section, just to keep us on track. I know we want to talk about technology and data privacy. Andrea, at a high level, as we're talking about international travel and all of these different health passes kind of interacting with one another and with people's, quote unquote, personal or private health information, there are obvious concerns. And I think this has been prevalent in a lot of the discussion, both in the media, but also a concern cited by a lot of the governors and legislators in the U.S. when they're issuing executive orders and other legislation basically prohibiting the use of these COVID passports. So at a high level, can you explain to the everyone today the data privacy concerns?
Mm-hmm. Yeah, sure. Absolutely. Privacy and data security are probably the two foremost issues at the center of every conversation around COVID passports and at the center of every standard and guidance that's being developed. I think as someone was showing their Excelsior Pass earlier, I think some people are less concerned. Yeah, I have to get that about, showing a COVID test or showing their COVID vaccine. I think that's considered normally less sensitive than other data. But I think where people are becoming more concerned is about apps that may store and collect location information for contact tracing, or apps or systems that may require you to hand over additional health information or sensitive information like underlying medical conditions. And this really varies by jurisdiction and by system. I think there's two core principles that I've heard being mentioned over and over again. One of them is user centricity and user control. We should try to avoid, regardless of the app or the system, we should try to avoid to store or collect anyone's data in a central database. It should be as decentralized as possible, and to the extent possible under the user's control in their own phone, where they're able to consent and manage their own data before sharing that with any verifier. The second principle, I think, is data minimization. And the reason for this is because every use case is going to have different privacy requirements, right? You don't need to hand over your entire medical record to check into a hotel. You might just need to show a yes or no, verification that you have taken a test or whatever. But on the other hand, for travel, there are some countries that are requiring you to show the entire test result or your entire, a much longer health record than just a yes or no, because they want to do the verification themselves. So I think it's really important to outline what those privacy requirements are per use case. Another issue that we're seeing come up with the passport discussion is the fact that there's many national or regional data protection regulations that are very complicated and difficult to comply with, like the EU's GDPR system or Japan's data protection regulations that are extremely strict. And so, passing this threshold for many of these apps and systems is going to be quite difficult. I think, we're still at the beginning of this journey. And I think as we start using these passports more and more, we should monitor any impacts on data protection, data privacy and security. And most importantly, also consider the implications beyond COVID, because a lot of these apps and systems that are empowering people with access to their own health data are very likely to persist beyond COVID and be used for all sorts of other health purposes beyond COVID. So I think it's important to consider those implications as well.
And Julia, in light of some of those concerns that Andrea just mentioned, what should employers be considering from a technology and data privacy perspective?
I think Andrea covered a huge amount of it. I think for us, it's very much about data minimization. So most of the private employers we're talking about, they do not want to be sitting in the situation where there's a data controller of this stuff. They need, sufficient access to be able to verify for the purposes that they really need to keep their businesses running and to make sure that their staff are safe. But they don't need to sit and own and store and collect data. If they're in that situation, then as Andrea said, you've got to follow all of your local compliance, GDPR, Japan, Korea, all of the different legislations in terms of collection, storage, and retention, as we know, as well as transmission overseas. So I think, the starting point for me is make sure you've got stakeholders in your business who understand data protection regulation, but are getting engaged at every stage when someone starts talking about COVID passport or health status data with respect to your workforce, and making sure that they're looped into that dialogue, because you don't want the data privacy guys coming in a bit too late to that discussion. The other thing is just making sure that you understand what your technology is able to do in terms of data security and data management, and where your data is actually held in which country. That's probably the question I start asking very quickly, and people go, I have no idea where my data actually sits. So if you are going to be in that situation, just start asking some questions internally so you're primed when you're ready and need to go. There is a question which I suspect probably came in, which may need to go to Mark, or may want to go to Mark, which is, I'm just looking back, which was about how do you address clients requiring your personnel to be vaccinated before going on site? Have you looked at that as a question where, for example, you're trying to get sectors and businesses to interact, and one company might be more sort of directive about requiring people to be vaccinated to get into a certain location?
Well, I'm going to give a very top line answer there, which is this is the kind of scenario that when I said employers and companies want to be able to work this out on their own terms, this is the kind of thing they want to be able to work out on their own terms. There are going to be, as we've seen, there are states now that are putting in place restrictions where they wouldn't be able to require this information or be able to ask about these conditions. But there are employers, there are companies that would like to be able to do that. And so that's where we would get into the discussion about how employers really don't want to be restricted or told what they have to do.
Yeah. And I think from our perspective, it would have to be a very justifiable question, right? So if that particular site had something particularly accessible to the general public or vulnerable members of the public that would justify it, you could build that into the metrics. I think if you're the employer whose personnel are going there and you don't have general access to their vaccine status, whether it's a situation of just effectively putting out there saying, look, there's a justifiable reason why people on site need to be vaccinated. We are asking for volunteers effectively to go and do that job on site without having to go so far as to asking each individual status. But that does mean you're going to have to reassign staff who can't comply to other roles.
I think that gets us into the next section perfectly, Julia, is the equity and accommodations, which I want to make sure we talk about, because I think that's the other kind of most important topic, particularly from an employment perspective. Andrea, obviously there are numerous countries that don't have access to vaccines, and there's issues of effectiveness, as you mentioned earlier. How does this access issue and which vaccines countries have access to play a role in the COVID passport discussion?
Mm-hmm. I think this is a really important question, and one that we're seeing just unfold in front of our eyes just this week with the announcement from the European Commission saying that U.S. vaccinated travelers might be able to come this summer. And it's precisely because the vaccines that are used in the US are accepted by the European Medical Agency. However, there's many others that are not yet accepted and still under review, including the Chinese Sinovac one, which I understand has just gone under review now, and the Russian vaccine, which I understand there's also many concerns with. So this essentially creates a huge equity question when you're talking about travelers that have those vaccines that are actually being used in other countries as well. So this is why it's important, for us, our position is that a country should not mandate vaccination as the only requirement for entry, because you're going to leave out a large, swath of the world. And there's also, it's really interesting to see the dynamics in the EU, because there are some countries like Greece who largely depend on tourism, which are allowing people to come in with the Russian and the Chinese vaccines at this moment. And so it'll be interesting to see how the national regulations, comply with the EU wider rules. I think, overall vaccines offer a way forward, but there's certainly not a silver bullet for reopening borders globally.
I think that is very accurate. One of the questions we've been hearing kind of most frequently from a lot of our clients is, can we mandate that employees get vaccinated and or require employees to show proof of vaccination? And here in the US, the kind of short answer is yes. But Lauren, I wanted to ask you, what do you do about employees who have medical, religious, or other reasons for being exempted from the vaccination or refuse to participate in the passport platform?
So US employees can claim a medical or a religious exemption from vaccination. The religious exemption from vaccination is part of Title VII of the Civil Rights Act of 1964. And the medical is part of the Americans with Disabilities Act. There are a lot of state and local corollaries that even go broader. So what we're starting to deal with employers that are mandating vaccination, or at least strongly encouraging it, and then maybe mandating it for business travel, for example. And they're asking, what do we do? If we get these, requests for exemption. I will tell you that the simple practical answer right now is that if you get a request, most of our clients are simply granting it and not delving deeper. They are not going. This doesn't really lend itself to the second and third opinions and the going back to the healthcare provider for multiple more layers of detail, like you would during the interactive process under the ADA, for example. And with the religious, what are you going to go back to the cleric and require more details on how deeply held the religious belief is? So that, as a practical matter, is what employers have been doing with that. And just kind of in the interest of time, let me flow into the next question, because it's related, and it's related to some of the questions here. We're talking about employees. What about customers and independent contractors? What about third parties requiring your employees to do something? What about schools and universities? We got all those questions in the chat. Here's the simple answer. That the religious exemption part only applies to employees, basically across the US, but that the medical exemption part applies across the board. So, you would need to consider a medical exemption for customers or independent contractors. Independent contractors, by and large, across the US should be treated like employees. Customers, other third parties, do not need to be treated like employees, but they do have a right, for example, under the ADA's Title III, if you're a place of public accommodation and you're talking about customers, you have to reasonably accommodate them to provide them accessibility to your site. So if you're mandating vaccines to come into your concert venue or into your grocery store, but you have somebody who presents a doctor's note that they have a medical exemption, you do need to work on a reasonable accommodation for them, unless it creates an undue hardship. And we don't have time to go into that now, but suffice to say that proving an undue hardship is not an easy thing. So generally, you do need to accommodate medical exemptions, even for third parties. So schools and universities, some have started to require mandates. Our daughter's university is requiring everybody to be vaccinated before the fall. But in Florida, for example, there was a university that had originally said they were going to mandate it, but after the executive order and now the legislation, they rescinded that mandating. And with third parties, they have a right to require it. So the question was, how do we work with third parties who are requiring our employees to be vaccinated? The third party has the same rights you have. So, you can try to negotiate with them, maybe do a workaround. Certainly if the person has a medical exemption or a religious exemption, you can try to work with the third party on that. So it's a complicated area.
Can I just add on to that for just a quick moment? The problem, as I had mentioned earlier, with mandating something is it implies a consequence. So any company that says you have to get vaccinated or that requires people, third parties coming onto their properties to be vaccinated, you have to think this through and understand what you're going to do if someone says no. There are different variations on no. There's the exemptions, and if somebody asks what religions wouldn't permit a vaccine, well, there's been some discussion about where the original source material for some of these vaccines came from, and so some people have problems with that technology, with that biology involved. The problem really comes in when you get somebody who doesn't have a good exemption, who says, no, I'm just not going to get the vaccine. And then what do? You've got to make a decision. You may be able to stand up and say, sorry, we can't use you, but you're also begging to have somebody come after you. It's a tough question. I don't think there's a good answer here. And just understand that there isn't a good answer, and you're going to have to sort of decide where you want to, make your stand. And one other thing, on accommodations, you can find things for employees to do sometimes that do not involve the interaction with other people. Sometimes you can have them work from home. Sometimes you can have them work at a part of the location that doesn't involve interactions. There are some times when you can accommodate an employee who won't get the vaccine. Not all the time, not every employee, but those are the things that you should be looking at if you're going to try and require employees to be vaccinated.
And very briefly, going back to what Andrea mentioned at the beginning, and we at Seyfarth are wholeheartedly in favor of this, just thinking narrowly about vaccine or bust is not necessarily the best way to go. In fact, it probably isn't the best way to go. There are other things that can be done. So maybe you require somebody to wear masks when you wouldn't require the vaccinated people to wear masks. Maybe you accept a recent PCR test instead, or antigen or antibody. So that's precisely why the passports, we don't refer to them as COVID vaccine passports. And we agree with Andrea, we'd like to refer to them as health passes, but we're not there yet in the US. But we recommend that you consider all of these indicia of COVID status.
Yes. And I would second that. Like, I think the sort of mandating access to generally speaking to sites and businesses with vaccine is a little bit of a sledgehammer to crack a nut, and it's kind of slightly the easiest way out, because it says, okay, I've covered my liability if everyone has to have a vaccine. Certainly for us in Asia, most of our businesses have been open, people have been back in the office working, yes, some in and out, but with all the other measures, and if that's possible and still maintaining relatively low community spread, then you've got to question whether mandatory vaccination really has a place in the vast majority of our businesses, appreciating the lack of tolerance for mask wearing in a lot of other countries.
So I think I'm keeping an eye on the clock. We've got about 1 minute left. So I want to go ahead and read the CLE code. It is SS as in Seyfarth Shaw 2284. And I'll read that one more time. SS 2284. So we want to say thank you to everybody for joining us today. We hope you enjoyed this discussion. And, as always, Seyfarth Shaw attorneys are here to help you kind of continue to talk through some of these issues, answer any further questions you have. So feel free to reach out to us. Thank you.